Hi, this is Five Questions with an ISHLT member, and I am Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation. And I am here today with Haifa Lister. Hi, Haifa.
Hi, Jess. Thank you for having me.
Thank you for being here. It's great to see you. Before we dive into our five questions, maybe introductions are in order. Do you mind sharing who you are, what you do, and what your role is with ISHLT?
Okay, so I'm a consultant pharmacist, predominantly on cardiothoracic transplant and MCS. So that covers from ITU inpatients and long-term in clinic, based in Harefield in London. And I have honorary academic links with King's. I am currently the chair of the Advanced Heart Failure and Transplant IDN Steering Committee, having been a previous Pharmacy Council chair.
Well, fantastic. And I know that's a mouthful. So
it is.
Well, thanks for everything you do for the community and for ISHLT. And I'm going to dive into our five questions so that people can get to know you a little better. What got you first involved in ISHLT and what keeps you here? Obviously, you dedicate quite a bit of time. What's the calling for you? What makes it a passion of yours?
So I started coming to ISHLT many moons ago. Initially to attend and obviously learn and everything, but I had lung transplant consultants and heart consultants that used to go to the meeting, come back with all these ideas. So I thought, well, why don't start attending the conference, then I'll understand what these ideas or where these ideas have come from so I can actually support when they come back with these ideas. And then there was a pharmacy council that was created. So I then got to meet several, pharmacists, mainly predominantly in the US, and then had opportunity to then start getting involved. And the thing with ISHLT, once you start dipping your foot in or your toe in, you have more and more opportunities, and lots of people encourage you to continue to contribute and collaborate. So I guess it's without being too corny, you kind of feel like it's your home, because I do heart transplant, heart failure, lung transplant, MCS, and otherwise I would have to probably be involved with several societies. And I guess ISHLT has all of that in one place. And it's a lovely network of people. I've now got friends, I do call them friends, they're from the US, from Australia and so forth. And one thing that was really great in Boston is, having not seen people for about 2-3 years, it was just absolutely lovely to be able to just meet people in person again. So that's fantastic as well. And it's very much multidisciplinary in nature. So, yeah.
Absolutely. A one-stop shop and a nice community. You couldn't have said it better myself. So I know that, you've talked a little bit about, you've worked with you do heart transplants, lung transplants, MCS, you're involved in pharmacy. I know there's some other elements to your career, like infectious disease. What inspired your career path? How did you get into this field? How did you end up where you are?
So I kind of fell a little bit into it, and it just kind of grew. So initially I came to do a 1-year post at Harefield, and I had wonderful mentors both within the pharmacy and the consultant body within transplant, and I used to just kind of cover and support them. And then over the year, then I developed, then it became a specialist post, and I absolutely loved it. Initially I thought I was going to be going to Hem-Onc or into renal, but I then stayed, and it just kind of has this ability of just getting hold of you, because it's changes all the time. What I'm doing now is so different to what I was doing 20 years ago, and I love the patients. I remember the first time doing a clinic and seeing a lung transplant patient coming back from a skiing holiday, and it is literally life-changing to see. So it's quite inspirational, and I love the MDT working. So it's not just pharmacy, it's ID, it's heart, lung, amazing nurses, amazing other allied health professionals. So it is very much a multidisciplinary group.
Yeah, you're like a poster child for our multidisciplinary qualities. It's really great.
But it's what ISHLT, and it's what transplant is. It is very much multidisciplinary. So, yeah.
Absolutely. Well, Talking a bit more about your career and about that field, is there a meaningful milestone, either something you've achieved personally or something that you've seen in the field that just really comes to mind that you'd like to share?
Okay, so I'm trying to think. So probably when my consultant post was developed, it's the only one in the UK. And at that point in time, there was only 40 across the UK, across all specialties pharmacy. And so it just meant that I could develop a team to be able to expand and support more across the MDT and the patients. In the UK, there was a big, massive legal change, so I was able to start prescribing from 2008, and that meant that I could help and contribute more to patient care, both on inpatients and in clinic. So we have a team pharmacist, and we prescribe all the immunosuppressants for all the patients, inpatients, and support those outpatients. I then thought it was a great idea in my late past my career to do a PhD. And so despite COVID scuppering it, I can see the end of it. So hopefully in the next 6 months, that will be coming to an end. And being able to have different roles within ISHLT, of which there's lots of different roles that people can be involved with. And I was lucky enough to have had the opportunity for several of them.
Well, it sounds like it's been a really groundbreaking decade or so for you, and we're really looking forward to celebrating your PhD with you when you complete it. So definitely shout that out. I bet. Well, you've talked a little bit about this already, just that over the last 20 years, what you've done has changed so much. So now look ahead as you look at the future of your specialty of pharmacy transplant care. What do you see on the horizon? Do you have an idea of where we might be in 5, 10, 20 years?
So, like I said, I mean, it's forever always moving. So CFTR modulators in cystic fibrosis, so that, that those patients coming through and its use potentially post, we don't know. SLG2T2 inhibitors in heart failure, bacteriophages with the ID community. There's many more new anti-infectives, and we're learning how to use them more vaccines, xenotransplant, which has again, been a big feature as well over the last 6 months. And then personalization for patients. I think it's not just a one-stop fits for everybody. So omics of all sites, whether it's pharmacogenomics or other types of omics. COVID has made us more innovative. So again, it's making us think a little bit outside the box for virtual consultations, finger prick testing, made us more collaborative, both within ISHLT, across the IDNs and societies together. So there was a lot more, like there's cross collaborations for webinars with AST and ESOT, for example, and also looking, say, from the pharmacy community. Amazing group of pharmacists coming through from when that first little meeting where there was only a few pharmacists with ISHLT. Now there's so many. It has grown as a professional community, and hopefully it will continue to grow and kind of push boundaries and collaborate more.
Absolutely. Well, you've made me feel really optimistic about the next few years, which is a great feeling. So when you're not pushing boundaries and making all these personal milestones, saving lives, what are you doing? What's your idea of a perfect weekend?
So, okay, perfect weekend.
Whenever in the week that may fall, just when you have some free time.
So I have lovely friends and family. So if it was a perfect one, I would like it to be sunny, which doesn't always happen in the UK. Having barbecue by the beach or along the river. I love the river through London. Otherwise, holidays. I have an amazing son who's at university at the moment, so it's lovely to be able to spend time with him. And we've had several adventure holidays. He's made me go shark cage diving in South Africa, and I've parachuted along the rim of the Grand Canyon. So I don't think of what's next, but they're always amazing, and it's lovely to see, being able to do that with him as well.
That's amazing. You're a little bit more of a thrill seeker than a lot of the people I ask this question of. So I think that's the first time I've heard shark cage on 5 questions. So
it's amazing.
I bet. Well, Haifa, it's been wonderful to speak with you and to hear about everything that you're thinking through and working on. And thanks for taking the time today. Is there anything
Thank
else you
you.
want to share with the ISHLT community that we haven't covered today?
I guess it's just a bit more of everything. So if you get the opportunity to get involved, do get involved, because, from early careers all the way through, it's, people do want to have people get involved with lots of new ideas. So yeah, get the opportunities.
Absolutely. I think you've given people a lot of ideas on how to raise their hands today. So thanks again and take care.